So, welcome to the Cosmic Powerhouse and another episode of Let's Create a Healing Temple. Today we talk about diagnostics and a special type of diagnostics. And for this, I want to welcome Paul Desmond Slowey. Welcome, Paul.
Thank you so much. Thanks for having me.
He's our interview guest today and will tell us more about a special type of diagnostics. And before we go into that and more into the introduction, I want to open a sacred space for all of us. And that's where we just bring an energy field around us, and I bring it over the space. So you're all also our listening or watching audience is included in that high vibrational energy. So if you want to join me, you fold your hands in front of your chest, you take a deep breath in, and you bring your hands up over your head. So breathe in, and then to the side, you exhale and create that kind of golden egg or bubble, which is filled with your energy field, your individual energy field. And then I bring it for you over the space to include all our audience in this high vibration energy and to let ourselves be grounded and be of full attention for Paul. Let's do a short breathing session as well with 3 times, inhaling, exhaling. And when you exhale, please just think about growing roots into the ground. So we take a deep breath in and out. And in and out. And last time, in and out. All right, so we should be grounded now. That is what you actually can do every morning. So I do it following a Kundalini yoga session, which is a bit more intense then, but actually right away to breathe and ground yourself is a very good step going into a more grounded spirit for the day also. So let's talk about Paul now. Paul D. Slowey is the owner and CEO of Oasis Diagnostics Corporation. So very nice name for a company name, Oasis. You shall tell us more about that. He is a member at Life Sciences Washington and also member at Oregon Biosciences Association. And what we are talking about today is diagnostics. And in this case, it's about saliva. So it's a special type of diagnostics, which I guess, know all about that because we experienced that with the COVID pandemic. But Paul will tell us today where it is used in various ways. So there's so much more areas where we use that type of diagnostics. And usually when we talk about diagnostic of disease, of also detect some disease or issues and looking for parameters. We think about blood. So like my dress today, red, blood. This is more the arterial color. And but there's a non-invasive opportunity which we can go, and we will learn more about that from you, Paul, right? So
absolutely.
But now I'm really interested to hear, why do you focus on saliva diagnostics? So what brought you here? What is your personal and professional journey to have a company and a strict focus on that type of diagnostics? So we would be very interested to hear about that.
Yeah. It's a very circuitous route. You know, I think if we all look back on where we came from and how we got there, there's like I would call it a zigzag path. But at every corner, there's a decision-making tree to make. Do I go left? Do I go right? And I seem to have made all the right decisions to get where I am. But you know, the ultimate goal of my company right now, and I've been in this business for 30 years now with 3 different companies, all involved in salivary diagnostics. And to be honest, back 30 years ago, this wasn't trending at all. Saliva wasn't important. Nobody even looked at saliva. But at that time, I made the decision to try and help people, hopefully make things less painful. And at the same time, if we can save a few lives, that would be phenomenal. I mean, when I started the company, it's now 22 plus years ago. That was really the mandate. Develop some technologies that can be used by people non-invasively in all areas of life, if you like. And at this point in time, we can safely say that we're probably one of the pioneers in this area, in that we can collect saliva for just about anything and from just about anybody. So, to give that in a few more words, we can collect DNA from saliva for your genetic testing or your ancestry. Or consumer genetics, for instance. We can collect RNA for COVID testing. We can collect proteins for things like Alzheimer's disease, Parkinson's disease, looking at biomarkers that might be elevated or either reduced by using holistic approaches. We have devices that can collect drugs of abuse, for instance. We can collect hormones for, PCOS and, women's health and men's health. But then we can also collect from every population. So we can collect from an infant, a baby, a geriatric, and a normal adult human. And then every animal, from the smallest animal all the way up to the largest animal, from a rat all the way up to the size of a horse. And,
Okay.
every animal in between. And, we have what's called a point of care device. So we can, in 20 minutes, we can literally quantify the amount of biomarkers in saliva using our technique. It's called Verify and Liam. That, for instance, will be able to tell you what your stress level is, how stressed you are from daily life. Your cortisol level spikes. And I was going to talk about this later, but the most stressful situation is when somebody puts you in front of a crowd and says, speak. Literally, you're in the middle of a conference and somebody says, can you please get up and speak, Dr. Slowey? That is when your cortisol level spikes to the highest particular level. But you can
Very
also,
good example.
yeah, you can look at cortisol for happiness instead of stress, because we had a project with a very famous actor, and I'm not supposed to name who he is, but we did a project in Nepal, for instance, where we sent our device over there, and this particular actor, who's very, very famous, was monitoring cortisol levels as a determinator of his happiness level.
Wow,
Right?
I never
So,
heard that. That is so
no, I
interesting,
mean,
because we always connected to the negative side. So it's stress,
right, right.
stress, negative.
Right. So
Wow.
I want to sort of go back to my roots, because, one of the things, a lot of people are entrepreneurs and they're in it for a specific reason. I go back to my roots because I was born in the northeast of England, in a very working class town. It was the largest coal mining village in the world. It had 7 coal mines and 30,000 people. So it was kind of a very rough area to live. But my parents didn't have very much money, but they made sure that we had everything. So, the reason I mention that is that money is not really the driver for this. The real driving force is, how can we help people as much as possible? And, when I go into some of the applications we have later, I get really, really excited about how we can help those people. So, what inspired me, it was just by chance that I became an entrepreneur. I came from the research and development area. I worked in drug discovery for a company called Sterling Drug, developing brand new drugs. I had a team of scientists that we were working to identify new drugs for steroid hormone disorders in women and men. And I woke up one day and said, I don't think this is right for me. And I emigrated back to Canada and found a job for a very large company now, that is, I think that maybe $500 million, something like that. And I ran all their international distribution network. But I kind of made the transition from research and development to marketing. It was not meant to happen. It just happened. So there really isn't any rhyme or reason to that. But, I got headhunted by a company in Vancouver, Washington, where I live now. And that's almost 30 years ago. So all in the saliva world since those 30 years.
Wow, wow. Yeah, so we can say you are a real expert. So for such a
I'm
long
a,
time.
I'm a
But
real
that's
expert in a narrow area of it.
yeah.
There's there's a commercial area. Just another example. I organize saliva symposia around the world, what the reason, and they're not huge meetings, but what they do is they bring together the key opinion leaders in the world that are developing new tests for saliva that use saliva as a specimen, and then the commercial companies that are already in that commercial world to try and get them to come together to make the next generation of saliva tests. They don't have to use my technology specifically, as long as they're developing new technologies, because the way that I see it, the more tests that are available that are non-invasive, we can do them at home, we can do it ourselves, we can send the sample into the lab, we don't have to go down to the lab to actually get the test done. That makes it much more convenient and easy, and again, less pain. And the more people that are out there, the better, in my opinion.
Yeah, and that brings us to the point. So beyond the physical and also let me say the motto, our goal here for the healing movement is to create a more spiritually attuned world and a healthier environment, and also respect the individual, the soul, honoring the soul. So for me, it is also a bit connected to that point, right? Because you say to make life easier for the people, for the patients, to have more convenience here, to not drive, maybe because, well, where I live, it's really very easy. I go around the corner and I have a lot of physicians there and laboratory stuff and everything. But when we look at the world, we have very different areas. And in some areas, people have to travel a very long distance to actually go to a laboratory, or to reach some kind of physicians. So for this, we also have to think, of course, when we create or develop solutions that we can.
Yeah. I just heard a story. I just heard a story the other day from Canada where one of the provinces in Canada has a very high indigenous population, and their oral health is dubious because they don't maintain good oral health. They don't brush their teeth every day. So in order to get them to a dental office or whatever, they have to fly them down there, put them up in hotels. It costs the country of Canada literally millions and millions of dollars to actually do that, and that just be for one visit. Maybe later on they have to come back for another visit. So having things that are suitable, and it doesn't have to be saliva, it could be other non-invasive technologies like urine, tears, sweat. These things are all moving forward as well. Blood is still good. I mean, blood is still the mainstay of everything that's done these days, but if you can identify an option where saliva can be used instead of blood, that's obviously going to be more patient friendly.
Yeah, that's a very good point. So it's really building the bridge, right? So, and working together. That's also really the theme of this podcast show. Let's create a healing temple together. And that is my aim also, to really, help building the bridge between so many different kind of alternatives we have already. We have with different solutions. We also have we call it still now alternative ways, but also for me as a spiritual healer, right? Or shamanic, you mentioned the indigenous people. So we have so many options because they also have tradition and have culture, and they have their healing abilities as well, but of course also need sometimes help where we need some other options. So, but yeah, I'm always more the person who likes to build the bridge and not to accept that we live with those silos, right? We have this silo and that silo, and in the worst case, they don't talk to each other. And and so it's really also with the show to show all alternatives like your solutions, and it's really incredible what we can learn. So I worked in that environment for a long time, but I did not hear so much in detail about that. So I learn a lot. So
well, hopefully we'll talk a little bit more about that, further down the podcast. There was a lot of things that have been done.
Yeah, we do. So maybe just to bridge that, because we already talked about the greater vision for healthcare, future healthcare, and helping people. So before we go more into details, maybe what is your vision when you think about it? So where could it be then going to when we look at a more holistic healthcare system? How could you see it in general or also connected to your solutions?
Yeah, well, yeah, I'm a very spiritual person. I believe in God and Christian principles, but I'm not what I would call a religious man. I don't go to church every week or anything like that. But I do believe in spiritual energy and forces that integrate with the principles of modern medicine. My sister, for instance, in the UK, you mentioned before the podcast, she's a grand Reiki master. So she does Reiki, she does reflexology. She practices all these things from usually people that are suffering from cancer and potentially in
Mhm.
hospice care and that type of stuff. But my sister is just a special individual. You really need to do a podcast with my sister, I think. But
Very
separate,
welcome. Yeah.
separately,
Healer session.
yeah, but I mean, capturing diseases from diagnostic principles is really important. But then once you've done that, what do you do, right? It's critically
Mhm.
important that we identify that somebody might have Alzheimer's disease, where saliva and other bodily fluids that I mentioned earlier can be critical, but we got to be able to use all these other approaches to help the
Mhm.
patient. Yeah, I haven't done a lot of work in this area myself, but I did publish one paper on mindfulness in Alzheimer's patients, and the study was a good study, but it needs to be done on a lot more rigor, if you like.
Mhm.
But the fact that it's certainly proven that things like yoga, mindfulness, exercise, good nutrition can slow down the course of Alzheimer's disease, Parkinson's disease, and many others. So you really have to integrate the holistic approach with the diagnostic approach, and I think we talk a little bit about it later on, but there are some approaches that are actually having some really major benefits at this point.
Yeah, yeah, I like that you're mentioning that also studies, because some people are thinking we don't have evidence, but there's a lot of evidence available. So I hear from my Kundalini teacher from the Life Force Center a lot about that. He is a physician actually from his profession. And so he is telling a lot about when we are talking about Kundalini yoga and to activate life force and what it actually does to our nervous system, to our glands like the pineal gland, pituitary gland, and so on. It's incredible what kind of impact that can have in each life. So that's why I love to have it in my coaching program implemented, because it is not difficult. Also here people think it's complicated, but it's not. There's really very little exercises, short exercises in 10-15 minutes. I practice that every morning, so you can activate your life force and can actually set a foundation, a base where you can activate also your glands and your nervous system, and also go out of this brain fog, because you mentioned also Alzheimer. It also has a lot of impact on mental health, a very positive one.
Yeah, well,
So
actually, when we did
yeah.
our first work with the verifying the Liam, the point of care device for cortisol, we actually
Mhm.
worked with a bunch of naturopaths. One of the biggest naturopathic centers in the world is called the Healthcott Institute here in Portland, Oregon, and we did a lot of work
Mhm.
with them during that early validation phase. That's probably back in 2017. So they were already looking at it much earlier than that. Yeah, probably
Okay.
around about the year 2000. So there is a lot of work ongoing.
Yeah, yeah, I would say so. There's a lot of studies, a lot of evidence, and especially now as it coming more into focus to really work together. So maybe also if you have some very interesting papers, we can provide that for our audience, maybe with a link, or you tell us then where they can find it, maybe on your website.
Absolutely. Yeah,
Yeah.
there are some on the website. A lot of them, I have, a personal stash. I'm happy to send them to anybody who's interested.
Excellent. Thank you so much, Paul. So going more into specifics here, yeah, the future of medicine with your technology and solutions. How could it shape the future of healthcare also towards self-healing or preventive care? You already mentioned a lot about in which areas it can be used. So do you want to add to
Well,
that?
I think I touched on it a little bit earlier when answering the earlier question, but additional things that are really important, I think, is to take control of our own health, and especially our oral health. Oral health is tied to our overall health. Back in the year 1990 something, I think, Dr. Lawrence Tabak, who just resigned from Deputy Director of the National Institute of Health here in the US, called saliva a mirror of the body's health. And he
Oh,
said we
wow.
can we can determine a lot of things that happen in the body. This is way back when he was a dentist. Then he became the head of the NIDCR, which is the National Institute of Dental and Craniofacial Research, which is one of 27 divisions in the NIH. And then he became actually deputy director of the whole NIH, which is the whole 27 divisions. So a very important man. But he coined that phrase a long, long time ago. But, a good regimen of looking after our mouth, flossing, we, mentioned flossing, brushing your teeth. Alzheimer's is now kind of implicated in poor oral health. It leads to a higher risk factor for Alzheimer's disease and other neurological diseases. So it's really important that we keep our mouth in good shape, as well as part of our overall approach to health. What other things? Yeah, my expertise is in saliva and applying saliva to diagnosis of disease, as we mentioned. But there are now what I would call a lot of tests that are available, and it's very strange that in the literature people will say why use saliva? There isn't really a body of evidence or a great enough body of evidence, but there is. I think the more that you look at it, I have 7 book chapters published. I have 1 book published. I'm happy to share these with anybody. They talk about what applications have been done for saliva, what tools are available. It includes my technologies, obviously, but it includes everybody else's. It's not biased in any way. I try to be as informative as possible. And what things are being done. So right now you can determine your biological age from saliva. We have organizations that are looking at hormones for stress, dry mouth, periodontitis, cancer, Alzheimer's disease, Parkinson's disease, you name it. Just about every disease is being looked at in saliva. And it's in certain cases, it's just a simple means of just validating a blood specimen that's already been used for a diagnosis for a lot of years to a saliva specimen and collecting saliva from the patient instead of collecting blood. So it's not really rocket science, to be honest. But you still find that a lot of companies have a mental block when they come to using saliva. They always say,
so that would be my area to release a mental block that we can bring it forward. So no, I'm really wondering, because when I'm listening to you, I cannot imagine why there is so much block and why this is not more used, because there are so many arguments for saliva diagnostics, right? And this is why
I have the symposium. This is why I organize a symposium. This year we have one in Italy, and you might want to attend that meeting. It's in Verona between September 15th and 17th. Okay. So again, we expect to have about 250 people attend this meeting from all over the world, hopefully some of the world's opinion leaders on saliva. So it would be a really, really important meeting. One of them is we have one customer who actually looks at using a technology to overcome jet lag, for instance. Nobody likes traveling long distance on an airplane, for instance. So what you find is your salivary flow diminishes quite rapidly during long-term flight. So in order to recover the amount of saliva that you have, the quantity of saliva in your mouth, she originally came up with a diet. So, you would have meal A at one point on the flight, meal B in the middle, and meal C at the end. And then she decided she would miniaturize it into pills. So and eventually it became 2 pills instead of 3 pills. So you take probiotics at one point on the flight, and then just before you land, you take another one. That technology is called Jet Renewal Kit, and it's my good friend, Dr. Patty Milligan. And you can purchase this anywhere in the world, I think. And it does work. I used it on trips to Australia. But again, it's based on saliva science. And, like I said, there's a lot of things that are based on saliva science.
That's really outstanding what you're telling us. So it's really amazing what we hear about saliva. So never heard it before. Maybe I didn't look enough at diagnostics in that way, but
all these diagnostics can be integrated with some of the things we talked about, like yoga and mindfulness and Reiki and reflexology and all these types of things.
That's why I'm wondering, because in these times now, with more and more awakened people, so really people going back to their soul connection, inner connection, and where wellness and health is really very much developing the market. So it's so much more focus on it for a good reason. So I'm looking more for the root cause, because I find it very important that we go out of the hamster wheel and not treating all the symptoms all the time, but
all the time. Correct.
just
That's really
go to the
important.
root of everything and then have a better life, a more fulfilled life and healthier life. But yeah, it's true. So as we are already talking a lot about that, where we could implement that, I'm really wondering why it's not happening. But maybe we change it today, Paul.
Well, I didn't mention this earlier, but I'm the co-chair of a saliva working group under the umbrella of the Alzheimer's Association.
Yeah.
So some of our devices are used by the Alzheimer's Association for risk assessment for Alzheimer's patients. But the most important thing is my working group is 50 individuals from around the world that are
Uh-huh.
concentrating on saliva for Alzheimer's disease diagnosis. So what we did was literally put a publication together that was just actually published December 31st, that is basically a roadmap on how to, first of all, what's being done in the world of saliva for, for genomics, for proteomics, for transcriptomics, for metabolomics, just about everything that's being done, and then provide some guidelines on if we are going to do Alzheimer's disease testing, on Alzheimer's patients, how do we do it and what sort of protocols should we use? How do we standardize the methods that we use to collect saliva so that we get the same results, from one clinic to another or from one
Yeah.
patient to another?
Yeah.
It's really critical because that's kind of been one of the drawbacks of saliva in the past is, you do it in one lab and you've got a specific protocol. You do it
Yeah.
in another, you got a different protocol and you get different results. So
Yeah. Amazing work. So thank you so much for all your work. I can already say so. It's amazing what you're
But,
doing with all
but
that.
that paper is available for if anybody's interested in receiving
Yeah.
that.
So I would say maybe we can just bring it on a list. So what is available, what you want to share, or where people can contact you if they want to learn more about this or that ongoing project, right?
Yeah, nothing is really, I mean, we have confidential stuff, of course, trade secret
Yeah,
stuff,
sure.
but most of the stuff we talk about is, freely available, published material that I'm happy to send to anybody.
Yeah, maybe also for the working group, just where people might be interested also maybe to collaborate with you so that they know
Absolutely.
where they can reach
That's
you
that's the
on
aim
what
of the
topics.
working group. Yeah, that's the aim of
Exactly.
the working group. And we are
Yeah.
trying to expand the working group to
Yeah.
individuals that might be interested in working with us. Yeah.
Yeah, exactly. And that is what we also want to serve. So really to connect, to build that network or to support that there can more people come in where collaboration is really so valuable. And that is so important for our world right now. So it is about collaboration. So really we have the globalization. So let's make the best out of it to create a healing temple together.
Yes. Very good.
So yeah, I also want to ask you about energetic imprints. So we know about biochemical data. So is energetic imprint, is that also a topic in your work? Is that also something you look at it?
Can you explain? I'm not sure I understand the terminology.
So when we have a biological sample,
Uh-huh.
whatever kind for, so we look at the biochemical data, but we know everything in the end. So like my cosmos behind is energy. So are you also looking for that, or is it a topic, energetic imprint, what it delivers, the kind of energy?
No, we have nobody working in that field on our working group, but that's not to say that we wouldn't be very interested in working with somebody. If you could either identify somebody that's actually doing that on blood samples or other
Mhm.
bodily fluid samples, I would be happy to entertain that. We may have somebody, but I've not seen any
Yeah.
publicized material from anybody on the working group.
Okay. Yeah, it's just to understand the deeper connection between the physical health, our spiritual body, our energy body, right? So
Mhm.
because we talked about the chakras, the energy centers, we know about that several thousand years from different kind of traditions and cultures. So we are starting to reconnect to that wisdom and see the comparison and see where it connects to our understanding from our Western medicine, right?
Mhm.
So that's why I'm asking that if it could open doors also for this topic. Maybe there's someone in the audience just listening who is actually
Yeah,
working
that
on
would be
that.
great.
So
That would be good. That would be good.
then you can contact Paul. He would be interested to hear about and maybe to work on something about that. Yeah. So your cutting edge work in genomics and diagnostic intersects with profound questions about human biology and consciousness. So how could we integrate scientific advancement with a more soul-centered holistic approach in healthcare? So how could we bring that together? You were already talking about science and how important it is to have a profound study culture and regulatory frame. So would you connect that also to the holistic approach, and how could it be done?
So I mean, there are already, to a certain extent, a number of people that already practice this, and there's obviously a very much growing body of literature to support the fact that a soul-centered holistic approach is the way to go. I think what needs to happen, in my opinion, is that more publications are needed, more funding from key researchers, to key researchers testifying to the beneficial advantages of holistic medicine. For instance, the NIH, I mentioned earlier, has 27 divisions. One of those divisions is called the National Center for Complementary and Integrative Health. It used to be called the National Center for, NCAM, National Center for Complementary and Alternative Medicine. So it looks at alternative medicine approaches. So they literally fund all sorts of interesting projects like that. But I think it's becoming more and more important in other divisions. For instance, the National Institute of Aging is the division within NIH that supports Alzheimer's and other neurological diseases. So they offer funding for holistic approaches as well, because they understand that in these particular diseases, these holistic approaches can be very, very beneficial. So, for anybody in the audience that's working in this area, I would encourage them to apply for these types of things. And I just recently became an NIH reviewer, and I'm proud to mention that. It's a very prestigious thing to be done. So in the future, I'm going to be actually reviewing submissions from people like that for the National Institute of Allergy and Infectious Disease, one of the 27 divisions. So it's a feather in my cap, and it's really nice to know that I can actually be trusted to do that sort of thing. So it's going to be
congratulations.
The NCCIH that I mentioned earlier, they provided about $1.6 million in funding for the development of my point of care cortisol test that I mentioned earlier. So, they are willing to provide funding for approaches like this that integrate all sorts of things. And like I mentioned, this particular device was used for happiness testing as well as stress testing. So it works both ways.
Yeah, it's really interesting. And that was just the thought I had. I just do not know about the split into focus on the pharmaceutical studies, so in that area, and the holistic approach, But
I think even the pharmaceutical companies are starting to look deeply at that, because they understand that they're going to be able to sell more products, because you have to be able to. So you've got a holistic approach, you've got a regular therapeutic approach. You have to know whether either of those approaches are actually working, right? So you have a patient who might have Alzheimer's disease. You do some mindfulness programs on them that do the biomarker levels that indicate Alzheimer's disease. Are they reduced when you actually provide that treatment for them? And the answer is yes. But you have to show that. So you have to be able to collect biological specimens in order to be able to do that. And the pharma companies want to know that type of information too.
Yeah. So do you see then a big shift coming up? So what can we expect from your experience? That
I
there's
think
more shift, and that there's really more funding available for the alternative and complementary medicine.
Yeah, I wouldn't call it an avalanche, but I definitely think there's a very fast and forward movement towards this type of approach.
Okay. Yeah, that would bring me to another question. So about self-healing and empowering individuals, because that is also what we want to do with our podcast, so, and with our movement, to actually support self-healing so that people know what they can do, live a healthier life, build a healthier life, away from addictions, know about healthy nutrition, how they can reconnect to nature, and how healthy is earthing, like we did in the beginning, also with a little breathing exercise, but there's of course more to do where we also have evidence that it has a very positive impact on our health. So what do you see?
I mean, I don't know about yourself in Germany, but in the United States, I've seen quite a movement towards that direction already. It's kind of gone are the days where the physician, you'd walk into physician's office and he said, "Oh, you've got X disease. I'm going to give you pill X or Y or whatever it is." It's now more, the patient is much more knowledgeable about their own health and diseases, especially since you mentioned earlier the COVID pandemic. Before the COVID pandemic, nobody knew what a PCR test was. Now everybody in the world knows what a PCR test is, or a rapid antigen test. And they've all used the one. So going into a doctor's office nowadays, it's a much more collaborative approach. And I think certainly looking at my physician, he's aware of the holistic approaches that he can recommend for healing. And I really respect my doctor for that. I've had some poor doctors in the past, but I think the younger generation, the current youngest generation, are even more in tune with their personal health and want to see something done about it. And I think when they recognize the tools that are available on the holistic side, they're going to look at those, in addition to getting testing for specific diseases. So, people are looking at better nutrition. I have some diseases. I won't mention them online here, but I have to take care of myself. I have to take specific foods that are better for me than others. So I make sure that I don't eat, too much fatty foods and that type of thing. And I think most people are aware of those types of things. And, it's just really an extension of that. And, the internet has helped, although there's a lot of misinformation on the internet. You have to be really
Other
careful.
diseases from that. So.
Right. Because I mean, for every study in the world that says, dairy products, the cheese and milk and cream are bad for you, there's a study that said they're really good for you. So, you have to be really careful on, I think it's everything in moderation is going to be acceptable. It's just don't overindulge in anything.
Yeah, that's so true what you say. And then I think many people discover that actually like we lived life or had our nutrition in the old days,
right,
would be not the bad thing to come back to that. Well, to have more vegetables, not that much meat, and to have not that much dairy products. So when I look at the coffee shops, so it's crazy, isn't it? So it's not the sell of coffee, so it's more the milk, because everybody is ordering a latte macchiato or only latte, so it's milk. So
and the pastry that goes with that, right?
The pastry, cheesecake and so on. So it's crazy sometimes how it is going.
But I think the advent of the internet has certainly helped some of these technologies like Reiki and massage and reflexology, mindfulness. All of these approaches are really important to integrate with regular diagnostics.
Yeah, I would also say it's really the more comprehensive approach, and it's a few life principles, right? So which you can implement, that you really have that foundation, because we're talking about the healing temple, and I can't mention that enough, that actually our body is the healing temple. So it's not only that we go to somewhere and say we go to the healing temple, like our fitness temple or the healthcare center or whatever. Actually, it starts with us, because our body is carrying our most precious thing, which is our soul. And there's an energetic body. So more and more people learn about that. And I know that sometimes it's not that easy to understand and to see that we have this energy around and through us. But it is really very helpful when you treat your body really like a temple. And so you would not feed it with very bad food, no. So you would have a good nutrition, good water, clear water, not
no smoking,
much sugar,
no smoking, no alcohol.
going away from the addictions. So We know from
You talk
the,
about the old days. You know, a lot of people have died really early because they smoked and they didn't know at the time that,
yeah,
you know, smoke was bad for them. My father is an example. He died, he was only 61. He had a heart attack.
yeah.
You know,
Oh,
it was all caused by atherosclerosis. If he had been aware that that was likely to cause the problem, he probably wouldn't have smoked, but they didn't know at that time. Yeah, now we know a lot more about our bodies and what we can do to our bodies to, you know, to maintain a healthy lifestyle.
absolutely, absolutely. And yeah, I also grew up in an environment at my time in the 70s. So people were smoking, also the young people were smoking. There was a lot of alcohol, a lot of beer drinking, and so on. So when you grow up in that environment, it's not that easy to go a different path, right?
Correct.
Go a
Correct.
different way because you're so much influenced. We know that we are as a human individual, we are so much influenced by the people we are spending the most time with. So when you have 5 people around all the time, so we are very much influenced. Also, you want to be the healthiest person on earth. So
Going
it's
back to my
hard to stand
history,
against it.
going back to my history, I mentioned, you know, living in a coal mine in town. The coal
Yeah,
mine in town only had 30,000 people, but it had 30 working men's clubs. Working men's clubs are places where people go to drink, and that's all it is. You know,
yeah.
there's a
Just to
bar,
forget
and there are
about the
people,
work.
and that's it. Yeah, for
Yeah.
one for every 1,000 people in the town. I mean, that's just crazy, right?
Yeah, for me, so I have to say, when I was going on my soul journey, and of course, our whole life is a soul journey, but more into the transformational phase and spiritual awakening, I learned so much about, what actually happened in my life. I went back to things, and I was releasing, blocking, and I learned a lot about trauma. So it was really the unresolved trauma, which I also experienced my life as a blockage. And it's really some work to do from several incidents which happened. I also learned that important is to find the root cause here as well, where you have a trauma, adverse babyhood or childhood event. So in the first 7 years, that is really actually very, very often the thing where it's going wrong the whole life. So
Oh yeah, your whole
it's
life.
a cause. It's really when you don't resolve that, you can have issues up to your old days. So that's where we really look into that. So I don't know if you also is that connected also to Saliva Diagnostic, where you have connected to that area of trauma healing.
Yeah, I mean, trauma is a big area for Saliva right now. In fact, you didn't mention earlier, I'm involved in two companies. I'm involved as the CEO of Oasis Diagnostics, and
Mhm.
I must mention I'm also Chief Science Officer for a company called Rapid DX. And Rapid DX is currently developing a test for traumatic brain disorder. So, you know, anybody that might have a concussion on a soccer field or maybe a fall in the house, in the home,
Okay.
actually more traumatic brain injuries caused by falls in the home than on soccer fields or football fields or, you know, any other sporting areas. So it would be a very rapid test that would use saliva to tell you whether somebody has had a concussion or not.
Oh, yeah, very interesting.
Mhm. You can do anything with saliva, to be
I
honest.
see. So
We could go on. We could
no
go on
matter
for
what
years
area
talking
I'm
about.
mentioning, you have some kind of solution with saliva. So it's really mind blowing for me and for many others, I guess, as well. So, Paul, when we were looking at the vision, also we were just speaking about that healing temple. So, what would you imagine of a healing temple of the future? What would it look like for you when you think about your diagnostic solutions, or also from your life experience, right, or science experience? So, what would you integrate in such a healing temple of the future?
So, I mean, we've touched on quite a few of the elements already, but I think, you know, the overall goal is to have a healthy, happy individual, right? So, maintaining a healthy lifestyle, eating well, something we haven't talked about in detail was, you know, maintaining oral health, but also
Yeah.
heart health. Heart health. You know, we can determine heart biomarkers from saliva just the same way, but, you know, we could have a heart attack at any minute if we weren't aware of what our current status is for our heart. Integrating the healing elements that we've talked about kind of multiple times, like mindfulness, Reiki,
Mhm.
reflexology, meditation, you know, yoga, even Pilates and things like that. You know, I've done Pilates myself. I don't like it
Oh,
very much,
wow.
but I'll do it. I'll
Me
do
too.
it
And it's really, I can also say it brings a lot of more stability, right, for your body to
for your
really,
body.
when
Yeah.
you train your muscles.
Yeah, I mean, I think that's the core. The strength in
Yeah.
your stomach is actually, key to the overall your strength of your body. So it's really important. Diagnostic technology's role will basically to provide that good evidence,
Yeah.
that the protocols we are following are actually supporting good health. Like I mentioned earlier, we can be diagnosed with Alzheimer's disease today, and then we can go through a program of mindfulness, and then we can relook at the diagnostic picture to see whether what we're doing is actually helping. If it's not, then we need to look at other approaches that might be certainly helpful. But I do think they all have an effect. And
Yeah, and also creating the healthier environment, like you say, it is because you can be the healthiest person on earth. Like I say, you can have a very good nutrition and practicing and a really very good lifestyle. But when you go outside and you have a polluted air and you have no clean water available and you have smokers around you or whatever, so you are influenced by
you were influenced by others, for
and
sure.
also by electromagnetic fields. So I wonder also how the 5G electromagnetic field and technologies will impact us. So we see already that people are reacting on that they cannot look at the screen anymore because it's too much for them, radiation, right? So there's a lot of
I think the other
changes going on.
the other thing that the diagnostic area can help with is monitoring as well. It's not just a one-off. We're not going to just do a test today. We're going to test that patient now, maybe 6 months from now, another 6 months from now. That's another area where saliva obviously excels. You don't want to have blood samples or cerebrospinal fluid samples, which up until fairly recently was kind of the gold standard for Alzheimer's disease diagnosis.
Yeah.
Very, very invasive.
So it's also for public health a very important option, right? Like we learned at the pandemic, but there are so much more areas where it could be used.
Very much so.
Yeah. So we were talking a lot about the future healthcare. Is there one call to action you want to bring out to the audience? Is there something which is really very close to your heart? You want to speak about that and bring it to the audience?
Well, I usually speak once a year at Washington State University, which is literally a university campus very close to me, and I teach the genomics class just one time every year. But what I typically do there is I talk about my life and why I got here, why I'm here, and how I got here. But then I say, believe in yourself. First of all, it's really important that you believe in yourself, and whatever you want to do, you know, do it. And you're going to come to the forks in the road that I mentioned earlier, and only you can make that decision. Your parents might be able to give you some inkling as to how to do it, but at the end of the day, it's going to be your gut feeling that tells you which way to go. And you're going to be right. I mean, I never believed that I was going to end up in the United States. I should have ended up down a coal mine like most of my friends, but my father made sure that I didn't. So there was a reason, and the reason that I'm here hopefully is hopefully to help more people. But don't give up either, because whatever you're going to do, there's going to be lots of bumps along the road. I mean, we look quite nice when you look from the outside here, but it's been a very roller coaster ride to get to where we are today. So never give up. Just keep doing what you're doing, and believe in yourself. That's really it.
So beautiful, so beautiful. Very important. Yeah, actually, yeah, that's exactly what we want, right? So to awaken the souls and to really come back to that soul connection and your individual soul blueprint and gifts, right? So because we are all here for a reason, like you mentioned, and it's so important, especially in these times of transformation where we need innovation, because information is a lot available. We can, get it everywhere, especially with AI tools. So a lot of information. But the innovation comes from the individuals. And the more you're connected to your soul, the more you're connected to your true wisdom and power. And that is what we need, especially also in the development and science area, right?
I agree. Yeah, very much agree.
Yeah. So we already learned in that session that you're doing so much that you must be 3 Paul. So yeah, it's amazing how active you are in that field of diagnostics and association and bringing things forward to a better health. So what is your personal wisdom again? So what are you doing for yourself? You already mentioned, of course, you have to take care for yourself and for your health. That's mandatory for you as well. But is there something you want to share with us?
Yeah, I mean, this is just a personal thing, but I love nature. So I'm
Mhm.
always out in nature. I love traveling. I used to travel. I have 2 million miles on Delta Airlines. So I've traveled the world. I've probably been to 55 countries, I think, in total. I love culture. The Asian culture is something that really inspires me. Temples, I
Mhm.
love the temples in Japan, Korea, China. Vietnam. I've been to all of these places, Thailand. For some reason, I just have this affinity with the Asian culture. I play soccer every week, or football, as you would call it
Wow.
in England. So I play for an over 65 team, and I coach soccer for a lot of years. I'm also a mentor. We have a new organization. It's a non-profit organization. It's called a STEAM Hub here. So it's STEM, science, technology, engineering, and math with arts added to it. So it's an organization of a lot of individuals in the Portland area, inspired by a good friend of mine called David Terrell, who just retired as a professor at Pacific Warner University here in Portland area. So, what we're doing is we're putting together shelters where youngsters can come after hours to learn from mentors like myself, about life in general. And, it's a place for them to go that's safe and they can play games and they can meet other kids. And it's literally just kids just coming out of, or in the high school, perhaps, maybe um, 13, 14, 15, 16 years old, maybe that age group. So that's a new project for me that's going to inspire me. I love taking photographs. So wherever I go, I take photographs of birds, nature, mountains.
Wonderful.
I post on Instagram for my friends and I post on Facebook. I try to keep in touch with my family. I love my grandchildren. I have 8 grandchildren. They are my inspiration. My son and my son that I lost many years ago are still my inspirations. But my grandchildren live in Canada and Tulsa, Oklahoma. So we have 4 in each place. So I have to split my time with them as well. And make sure that I'm a good grandfather to all of those kids. So, there's lots to keep me happy and energized.
Yeah, and that's what you're vibrating, I can say. So
Mm.
it's just really, there's this shiny light coming out of you, really vibrating. And wow, I'm really blown away. You must be a magician so that you can really maybe bend time and things that this is possible, what you're all going on. Yeah, maybe last question. Yeah, about legacy. So when you're thinking about legacy and hope and what you leave behind. So is there something you have imagined how that should look like? So is there something specific? So you already told us that you wrote a book and you're very active with the papers and studies and evidence and so on. Is there something special?
Yeah, I think,
Oh.
from day one, it was really, first of all, try to inspire other people, by example. Try to save lives if possible. If we've saved one life, it's been all worth it, right?
Mhm.
Because there we are involved in, and we didn't get into this earlier, but uh, there's 2 areas where I think we feel that we can be very, very valuable. One is in the field of neurological diseases like Alzheimer's, and we talked a little bit about that.
Mhm.
But the other one is in the cancer area. With
Mhm.
one drop of saliva, you can diagnose lung cancer in 30 minutes with a technology that was developed at UCLA in Los Angeles. And that is kind of the proof of concept for the development of a whole range of tests that can
Mhm.
detect other cancers. So these are the kind of things that inspire me every day. So I just hope that some of the work that we're doing and some of the published material that we put out there inspires others to do similar things. And, hopefully, mankind will benefit from it overall. That's really the legacy, I think.
Incredible. Thank you so much, Paul. It was really such a pleasure listening to you. It's amazing what you're doing. Thank you so much. You're a great leader. can see, and humanitarian. So thank you so much for sharing your wisdom with us. And thank you to the audience for listening to us. And yeah, like we say, we provide some links and where you can get the information from Paul about the different kind of working groups, associations, or papers. And so let me take back the energy field to close the cosmic powerhouse. Yeah, and we close with, let's create a healing temple together. Yes, so we have a lot of inspiration here, amazing leaders, amazing scientists, visionaries, and innovators, and all together we have so much more power and can really change something in the world. And I have to say, whenever I listen to the song Heal the World from Michael Jackson, I get goosebumps and think, yes, so let's do it together. We have the option, we have the opportunity. Let's do that. Thank you.
Thank you so much for having me. I really appreciate that and enjoyed that.
Thank you, Paul.
Take care. Bye-bye.
Thank you.